What's up, everybody? It's Mark again here on Facebook Live. We're, obviously you can tell, a little different setting. We're in Lacey Amos's office. She is one of the mental health care professionals that we go to. We bring a lot of our people to. She's also really instrumental in helping us at the compound with what we got going on there. So instead of us talking to you about the need for mental health care with the people we work with, we wanted to come talk to Lacey a little bit and let you hear from someone that's been in this field, that's a professional, and let her tell you a little bit more about that. So I'm just going to turn the camera towards her and ask her some questions to get going. If some of y'all tune in here in the next little bit and have any questions you want to ask, I can see the screen, and so you can type them up and send them in, and we'll try and get those answered as well. So Lacey, first question is just talk a little bit about like the population that Urban Purpose works with homeless, addicted, people that are struggling. I think a lot of times people tend to think like, hey, just get a job, get off your butt, kind of get things back together. What's your problem? And talk a little bit about what's going on with that population and why that approach is not successful and not really a healthy approach to take. So I'm going to have to turn here. Yeah. There's Lacey. She can talk there.
Okay. Yeah, so with the population that Urban Purpose works with, a lot of it would be addicted and homeless, and so there's obviously reasons behind the homelessness and behind the addiction, and so addressing those needs kind of at the core, at the root, is really important. And I believe it is almost half, not maybe about 46% of at least the homeless population, we'll just talk about that, is has either a severe mental health issue or an addiction issue, or sometimes both co-occurring at the same time. So to tell someone to just go out and get a job, well, they may not. That would be like telling someone who had a broken leg or severe diabetes with no insulin to just go out and work and go out and get a job, because mental health issues are just the same as physical health issues, and when there's major issues going on that are not being addressed, they cannot just go and do like somebody who's healthily functioning. So to address those needs is, if you don't address those needs, you're missing about a major percentage of what's going on with this particular population.
Nice. So, well, I was going to turn the camera back to myself, but nobody wants to probably look at me there. So what do you, what are some things, like if you talk about like just what you've seen with the clients, I guess for lack of a better word, that we've brought, that you've seen, like what are some common things you've seen in the Urban Purpose clientele that you've worked with over the years?
Yeah, so I've seen a lot of trauma with just in different ways, whether it be childhood trauma that would tend to send somebody into maybe a world of addiction, or a super unhealthy family dynamic where maybe drugs and abuse and stuff were introduced at a very young age. I've seen, trauma as a result of drug usage, being in situations where, maybe they're in an abusive relationship, and as a result of being in that, that world of addiction. Seen a lot of severe social anxiety, undiagnosed, of course, and, self-medicating with drugs, various drugs, Xanax or heroin or marijuana or whatever it may be. I have seen, just some underlying real bad anxiety that is trying to be medicated, or depression too.
Yeah, so like with what we're doing now, Urban Purpose, with the compound particularly, what benefit do you see of the compound as it relates to just mental health care and getting this population the treatment that they need? Like, why is it important?
Yeah. So the compound is amazing. I would encourage anyone to go spend some time there. But so specifically for the homeless population, which, people who are in addiction often, become homeless. So a lot of times this all kind of correlates together. But the proximity of the compound to where this population often spends a lot of time is important. So, eliminating the barrier of transportation is a huge deal because of where the compound is specifically and strategically located. People are going to be downtown in that area maybe already. So that is huge, and the convenience of it. And then just having a space where people can come freely and feel comfortable, and it's not pretentious. It's so just welcoming, and just anybody can come. It's very open. It's got a very open vibe and feel to it. And so specifically with what I've been helping with is this women's support group that we're getting off the ground. And already we've just had some amazing, amazing groups. I mean, I think we've only had 3, and all 3 have been amazing. And just to allow them to have free access to just a mental health professional. Not that we're doing therapy, we're only doing the support group, but just to allow them to know somebody who's a mental health professional and kind of see that it's not scary, and that it can be okay to talk to somebody. And that is huge. A lot of these people may have never even seen a therapist before, even know anything about mental health, and so introducing them to that in a very non-threatening way is super important. Should I go on?
No, that's good. Let me say one thing. I'll say just real quick, just so y'all understand what we're trying to do at the compound. If you haven't heard, as far as mental health care goes, and we have a lot of things we're trying to get going there, and that we are getting going. We've done Super Bowl parties and Final Four parties. We had a redemptive dinner there on Tuesday night, which is a sit-down catered meal that the homeless were able to come to. We had the Celtics and Warriors game going on, and so that was Celtics and Wizards, whatever. That doesn't matter. But we had a game going on, and they were able to hang out, and so to create this safe environment for them to come, where they can feel at home and loved and valued. But one of the things we're getting off the ground is this women's support group that Lacey talked about. I'm working towards getting a men's support group, but just to give free, no barrier access to mental health care. Because if you talk to a homeless person about getting counseling, you say, well, I'm going to pick you up down here at this time, and we're going to go to this office in Hoover or Homewood, and you're going to fill out paperwork, sit in a waiting room. That can be scary. But just to be able to come off the street into that environment and have access to a quality Christian mental health care professional, I think is a huge thing. It's one of the things I'm most excited about that we're doing. And so I think it's a big step forward, and Lacey's been a huge part of that, and so it's really it's one of the things that I get the most excited about talking about, because like she said earlier, with this population, it's just so easy for people to look at them, and there's so many stigmas, and to say, well, get a job, quit being lazy, you're just I don't know all the things that come with it, but there's so many layers that nobody woke up and said, this is the way that I want to live my life or to be. And so to have somebody that's able to dig in and help them deal with those things and process those things and learn better coping mechanisms and to come to grips with those things is a pretty amazing thing. So we're pumped about that. I'm going to ask one last question. Is just as I'm turn it back awkwardly to Lacey. So as obviously Urban Purpose and Lacey, we approach things from a Christian worldview and standpoint. And so as Christians, as believers, what is I guess I want to talk a little bit about the stigma of mental health care a little bit, and why should we as Christians and believers work diligently to get rid of that stigma and stigmatizing people that suffer there, and help them get access to the care that they need.
Yeah, well, I mean, just because somebody, well, this is a broad topic.
Sorry.
But yeah, so, I don't know, there is a stigma with mental health care. I don't know specifically why that's still there or what's going on with it. There's probably lots of reasons, but as believers, just we believe in physical illness. I'm not sure why people struggle to believe that mental health is a thing, and it's a very real thing, and severe mental health conditions are real. And just because you've maybe never seen somebody that has something like that, if you met somebody with it, I think you would know very quickly that it is a very real and legitimate thing. And that, medication is often required, and therapy is often required. And so We cannot just pretend like that does not exist. And people suffer. They suffer really bad silently. And, you can't look at the numbers and you can't just ignore this subject. I mean, almost half of homeless people have a mental illness or a substance use issue. So by ignoring mental health, we are ignoring half of the issue of this population. So anyway, as believers, like the role of, the Lord in healing definitely is a huge part, and we address spirituality in the support group and stuff, but, nobody would tell someone who was having a heart attack just to pray about it. They go to the hospital. I mean, it's just, that's simple to me. It's just that clear. I'm not going to tell somebody who's strung out and homeless just to pray about it. It's going to be okay. Yes, pray, but the Lord has given us access to health care. We have that. And so He's blessed people to be able to have treatments and medicines and things that people need. Now, that may be overused sometimes, but it's also a very real, legitimate thing. So, we need to allow the Lord to heal through the medical profession also. So.
Cool. All right, guys, we are about to sign off here. So you can come back and join here in a little bit and watch from the beginning if you've missed any of it. I just encourage you to keep following along with us on the 110 journey. You can go to our Facebook page, which I guess you're already at if you're watching this, but Instagram, Twitter. We're bringing a lot of content to talk about what we're doing through the compound, the jobs program, Haven House, our Safe House, and so a lot of these things work together, and those initiatives work together to help bring a holistic approach to investing in the lives of people in need. And so if you've seen also just the goal that we've got with the 110 Journeys to raise $110,000 to help fund those things. And so if I know that goal seems big, and I think it can kind of discourage people, normal people that can give $25, $15, $50, $100, something like that, and think, well, what difference does that make? But I'm here to tell you it all makes a difference. We have to have people from all levels joining in to give towards that. So if you believe in this and believe in what we're doing, even if it's a $10, $15 donation, whatever you can offer, it's a big part of us reaching that goal and being able to have things like the compound going, and Safe House, and our jobs program that can kind of come together and help folks get off the street. So you can head to urbanpurpose.org/110 to learn a little bit more about that. We appreciate you guys. Thanks for following along, and we'll be bringing more content in the next couple days and weeks. So keep up. Thanks.